So if somebody is a healthy 75-year-old person or even older, then there's no bar to their getting a transplant. So the main reason why a person will not get transplant is if they have got other conditions which will prevent them from having major surgery and having to take medications which are pretty hard. So in general terms, 70 is the cutoff age, but if you're otherwise healthy, there's no reason why you shouldn't get transplantation even when you are older. The other reasons why you can't get a transplant is when you have got something else which will prevent you from getting transplant, like cancer. So if somebody has got cancer and you give medications which prevent rejection, will also make the cancer go bad. So you cannot take that risk, and hence those patients will be contraindicated. And patients with major heart disease and other major limitations, of course, will not get transplant. But anybody else who has got no other major illnesses should be able to get a transplant. Unfortunately, the waiting list for transplant is pretty long. It takes 4 to 5 years for patients to get transplant. But there's another way to get through it, and that is by getting a transplant from living related donors. So if you've got a son or a daughter or a wife who would be willing to donate you a kidney, that is the best way of transplantation and the way to get forward. And it is becoming pretty popular. Unfortunately, not so much in the African American community, where living related donors are not that prevalent, but that is the way to go forward, in my opinion, to get the patients off dialysis and back to their normal life. And also, kidneys from living related donors do much better than otherwise and have got a very long life after transplantation.